My name is Fred Huerta with Nightingale College. Today I'm going to be demonstrating drawing up insulin. First thing we're going to do is gather our 2 medication vials, a syringe and needle, gloves, and alcohol prep pad. Next, we verify the healthcare provider order. Compared to the MAR, the order reads 4 units subcutaneously of regular insulin and 8 units of intermediate NPH insulin subcutaneously as well. Okay, so in total, we're going to be administering 12 units subcutaneously to the patient of insulin. Okay, so we're going to verify the 6 rights of medication administration, which are the right patient, drug, dose, route, time, and documentation. So we're going to go ahead, knock on the door, perform hand hygiene, introduce yourselves to the patient. Full encryption for privacy. Hello, Mr. Victor. My name is Fred. I'm going to be your nurse today. Could you please tell me your name and date of birth? Okay, just going to verify that with your wristband, making sure that correlates with the name on the order. Mr. Victor, before we continue, is it okay to talk about your healthcare information in front of your family member here? Yes? Okay, great. Mr. Victor, do you have any allergies that you can let me know of? Such as allergies to food, seasonal, or to medication? No? Okay, great. Victor, your doctor has ordered for you to receive regular insulin 4 units and NPH intermediate insulin 8 units. It comes in the form of an injection. So you're going to be receiving 2 medications in 1 injection. The regular insulin that you're going to be receiving, the way the mechanism that this works is that it pulls the glucose from your blood into your cells, and that allows you to use the glucose as fuel, which then lowers your glucose levels. This medication is used for it's a short acting insulin, so it's used to treat or provide you with your insulin needs for 30 to 60 minutes prior to a meal. Okay, some common side effects of this medication are hunger, anxiety, and shakiness. Some adverse effects would be tingling of the lips, seizures, and tachycardia. Um, the next medication would be the NPH. This medication is an intermediate, a longer lasting form of insulin. It lowers your glucose levels in the same manner as regular insulin. Um, this medication is used to provide you with the insulin that you need for around half of the day. Okay, so some of the common side effects of this medication are weight gain, sweating, and water retention. And some of the adverse effects that we'd be looking out for would be generalized weakness, headache, or confusion. So if you're experiencing that, please let us know right away. Upon administration of this medication, you can feel a stinging or burning sensation. Okay. Do you have any questions for me at this time? No? Okay. So I'm going to go ahead and perform hand hygiene. Verify that the medication that I have in front of me is the same medication that same medication that has the same medication that has the name on the order. Okay, so then we're going to be looking at making sure that the expiration date on the insulin is not expired, making sure that it doesn't look like it has clumps and looking like everything's intact. Okay, so at this point going forward, I'm going to have a nurse verifying the doses that I'm going to be administering. Okay, so I'm going to go ahead and start off by rolling the medication in between my hands. If it was at room temperature, this would help this would help get it to room temperature faster. If it was cold. Okay, so I'm rolling it, and then I'm going to go ahead and get some alcohol prep pads. Clean the top of my vial. Another alcohol prep pad on top of the vial. Okay, now I'm going to get my insulin safety syringe. So I'm going to be administering 4 units of air into the NPH. No, 8 units of air into the NPH, sorry. Okay. Verify that with the nurse. Make sure that correlates with the medical administration record. The amount of air that I'm going to be administering into the vial. Okay. So I'm going to go ahead and inject it. 8 units into the NPH. Making sure it doesn't drop any insulin. Okay. Now I'm going to go ahead and pull 4 units of air. Verify it with the nurse. Verify it with you guys. Okay. So before I administer this medication, I'm going to want to make sure I check the patient's blood glucose levels. Okay, so it administers the air into the insulin. And I want to make sure that I have, okay, so now I'm going to flip this vial of regular insulin, pull out 4 units according to the MAR. If there's air, I want to not do it. If there's air, I want to flick it out, okay? And then I'm going to be verifying that with the nurse. Verify it with you guys. Okay, then I'm going to inject this into the NPH. So I don't want to inject the regular insulin into the NPH, and I don't want to overdraw. Okay, so here I should have 12 units. Okay, 12 units. Verify that with the nurse, with the medical administration record. Verify that with you guys. Okay. So the 1 scoop method. Alright. Now I'm gonna go ahead and label this with the drug and the dose. Place that aside. Before we would administer this, we want to make sure that we check the patient's glucose levels and we have a time frame in which their meal is going to be arriving. Okay, and that should be all. So I'm going to go ahead and throw away everything aside. Move that aside, and should be ready to go. So remove our gloves, form hand hygiene, and document.